Okay, thank you. Hope you can all see my slides.
Yes.
Okay, so I'll give a very high-level overview of the DREAMS program. And I realize for some of you, this may be very familiar, but I'll go over some of the things that we're doing and just kind of give an idea of the role of DREAMS in HIV prevention, and end with sort of the next steps for DREAMS activities in high-burden HIV countries, which Zambia is part of. So UNAIDS has set targets for that ought to be achieved by 2025. There are also targets for 2030. And one of the targets for 2025 is reducing the number of new HIV infections to less than 25, to less than 370,000 by 2025, which is just next year. As of 2023, new infections globally were at 1.3 million, which is 3 times the target for 2025. So in short, this target is unlikely to be met because there's still quite a lot to be achieved in order to meet this target. And one of the groups where HIV new infections are very high are the adolescent girls and young women. In fact, the adolescent girls and young women have an HIV incidence that's 3 times that of their peers, the adolescent boys and men and young men, in at least 22 countries in sub-Saharan Africa. So this is from the UNAIDS data. So as you can see, that a large part of that large number of new infections globally every year is due to new infections among 2 groups of individuals. One is the adolescent girls and young women, and then the other group is the key populations. So for today's talk, I'll focus on AGYW. In sub-Saharan Africa, there are several reasons why AGYW are vulnerable to HIV infection. They are vulnerable, and one of the roles of the DREAMS project is to move them from that state of being vulnerable to not being at risk for HIV infection. There are social factors, there are cultural factors, a lot of factors that put them at risk at elevated risk for acquiring HIV infection. So again, going back to the new HIV infections, as you can see, this is from 2022, and it's not too different from 2023. So the top line there in blue is new infections in AGYW, the 15 to 24-year-olds. You can see that it's much higher than the one in their male counterparts, the 15 to 24-year-old young men. So it's more than double the risk of new infections. So just a brief background about Ciheb Zambia. So Investor Melinda has been implementing HIV programs in Zambia since 2004, and the names have changed over the years. Initially, it started off as IHV, and then in 2012, a local organization was registered, and the name was MGIC Zambia. And then in 2020, the local organization, the local affiliate became fully local, and the name changed to Ciheb Zambia. But in terms of staffing, it's more or less the same people that have been implementing the programs for the last 14 years, I would say, with some changes at leadership level. But it's generally the same teams that have been providing care and treatment support to the Ministry of Health in HIV programs. And after the change in 2020, after Ciheb Zambia became a local organization, all the funding was initially going through University of Maryland, was the prime awardee. And the most recent project was the Circuits project, which ended in 2023. And then from October 2023, Ciheb Zambia has had a prime award from CDC. The name of the award is the Advanced Project, which we're implementing at the moment. So ADVANCE stands for Advanced DSD for Vulnerable and Adolescent Populations for National HIV Epidemic Control and Equity. So it's a mouthful. It's a 5-year project, which has just started its 2nd year. As I mentioned, it's a follow-on project from Secutes. And ADVANCE aims to target the groups that are at most risk, at greatest risk for new HIV infection, which are the AGYW and other young people, and also key populations. So for AGYW, there are programs that are targeted for priority populations, the general priority populations, and then there's also the DREAMS program, which targets AGYW. And then we're using the KPIF model for key populations. So this is a key population investment model, which was initially started, I think, around 2019, 2020 by PEPFAR. There's some funding, which started the KPIF model in most countries. So this involves working with populations that are affected by HIV, that are most affected by HIV. So working very closely with civil society organizations that are led by key populations themselves, and also have a lot of their staff among key populations. So the main focus initially for the KPI investment was ensuring that those organizations get established, that they're able to run projects that provide services to the target populations, and then also training them in managing funds from the US government, and also just carrying out health development projects. And over the last 4 or 5 years, there's been a great improvement in the operation of those civil society organizations. A number of them now have funding from multiple sources, including PEPFAR, the Global Fund. I think those are the 2 main ones that fund the activities for HIV programs. And they've developed, their capacities have been developed, including financial management of donor funds. And so the focus of the advanced program is to provide targeted HIV testing, case finding for primarily those populations, and then link individuals who are HIV negative to preventive services, and link those that are positive to care, treatment, and adherence support, and also close the remaining gaps in epidemic control. So this is a conceptual framework for the advanced project. So there are 4 strategies, and the first one is mainly to implement interventions that empower and support, again, the groups that I mentioned, young people, adolescents and young people, and key populations, and also aim for health equity, again, for those populations. And the second strategy focuses basically on the key populations, and this is mainly through the KPIF. So under this, we've got sub-awards to 4 key population civil society organizations. They're the ones implementing programs in the districts where we're operating. And we've actually added a 5th one this year. And this is mainly through safe spaces. We also call them wellness centers, where beneficiaries can come and receive HIV preventive services. They also receive care and treatment, and they are linked to other services, including screening for non-communicable diseases, sexually transmitted infections, and now with threats of mpox in this part of Africa, we're also incorporating that as part of our services that we provide to these populations. And the target populations are men who have sex with men, female sex workers, people who inject drugs, transgender women, and prisoners. For prisoners, we provide technical assistance to provincial health offices. So these are part of the Ministry of Health at regional level. They're the ones who are providing direct service delivery for prison work, but we provide technical assistance as they work in providing services to inmates. And then the third is focused on adolescents and young people. So these are individuals aged between 15 to 24, both young men and boys and young women and adolescent girls. So the services under this program, HIV testing services, youth-friendly services, which are corners within health facilities where they can get services for HIV prevention in a friendly manner as opposed to the main health facilities. And then there's also community outreach and linkage to health services. And then there's also the DREAMS initiative, which will be the focus of my talk. And all this is supported working together with Ministry of Health and a consortium of Ciheb Zambia as the prime, University of Maryland, mainly leading in the activities that I mentioned in Strategy 4. And then we have other organizations such as Young Women's Christian Association, who focus on some aspects of the DREAMS initiative, and Expanded Church Response, which is another local nonprofit organization which focuses on parenting program in the DREAMS initiative. So the focus for University of Maryland is population size estimates, behavioral surveys for key populations, and also utilizing fear data so that we can implement precision public health for our programs. And they've also, University of Maryland has been supporting advance for monitoring and evaluation. And the goal is to achieve sustainable, equitable HIV epidemic control in all populations, including the ones that are hidden or the ones that are most at risk for HIV acquisition, and to meet the targets set by UNAIDS and PEPFAR. So the target population for AYP is, as I mentioned, it's adolescent boys and young women, and young men and adolescent girls and young women, and those activities which I mentioned earlier. So the DREAMS initiative was announced in 2014 on World AIDS Day, and the focus was AGYW for several reasons. One of which is because they face an increased vulnerability for HIV acquisition compared to their peers. Showed the information earlier, where there's more than double the number of new HIV infections in AGYW compared to adolescent boys and young men. And the PEPFAR strategy, the 5-year strategy, which was released a couple of years ago, we're kind of midway through that, emphasizes gender inequality and prevention of gender-based violence, and also response to gender-based violence. And the target group here is the AGYW. In 2022, AGYW accounted for 63% of new infections in sub-Saharan Africa. So Zambia is one of those countries where AGYW account for a lot of the new infections. So having a dedicated program for this population makes sense in order to achieve epidemic control by 2030. So DREAMS was announced in 2014 and currently being implemented in 15 countries. And DREAMS stands for Determined, Resilient, Empowered, AIDS-Free, Mentored, and Safe. So that's the acronym. It's focused on reducing HIV infections, new HIV infections in AGYW, and also pregnancy. So there'll be a contraceptive aspect as well because of the aim to reduce pregnancy in addition to reducing new HIV infections among this population. So a population actually starts, the interventions start for girls aged between 10 to 14, 10 to 13, and then also the ones that are 15 to 24 years old. So Ciheb Zambia implements a multidimensional approach to DREAMS activities. These include the core package, which comprises of empowering AGYW and reducing the HIV risk, strengthening families of AGYW and improve parenting skills, and mobilizing communities for change and reducing the risk of male partners. This is illustrated in the DREAMS conceptual framework. And as you can see that the girl is in the center. So the main goal is to empower girls and young women and reduce the risk of HIV infection. And this is done through mainly through social asset building, which is a program aimed, which is a core activity within DREAMS, social asset building. One of the vulnerabilities for AGYW is that they don't have mentors. They come from homes that are probably broken. They are orphans, and so they sometimes are not in school, and so there are a lot of things that put them at risk for HIV infections. So this multidimensional package aims to address all those challenges. So social asset building is a core activity that takes place. Then there's youth-friendly sexual and reproductive health care, which comprises of condoms, HIV testing services, pre-exposure prophylaxis, and family planning and post-violence care. And then there's also an aspect of mobilizing communities for change. These target two groups. One is the community themselves. And when DREAMS was being introduced, we had a series of meetings with community leaders to introduce a program, explain what it's about, and engage them so that they fully participate in the DREAMS program. And then there's also school-based HIV and violence prevention. So this works through schools, mainly high schools, because this is where the target population is mainly found. So there are programs that target at preventing HIV and also preventing violence in schools or school-based violence. And then there's also targeting of sex partners of AGYW. This is one area which we could have probably done a little better, especially the characterization of male partners to AGYW. So included in that is to characterize these male partners of AGYW so that we can carry out activities that are targeted at those male partners to reduce HIV infection. And this is mainly providing HIV treatment and also voluntary male medical circumcision. But we do carry out activities like those that are targeted at adolescent boys and young men through a program called Coaching Boys into Men, and also HIV testing and treatment for men. And as I mentioned, this is an area that we probably not focused as much as we should have. Then the other aspect is strengthening families. So this targets the caregivers or parents of all the beneficiaries that are enrolled in the DREAMS programs. So there are two programs that we're implementing at the moment, and these are done by our partner, ECR. And then there's also education subsidies. So this includes payment for school fees so that the girls that are not able to go to school because parents cannot afford or caregivers cannot afford, they'll be able to go to school. And then there are also other provisions that are made for schools, such as school uniforms, books, pencils, and everything else that they need for school. This has changed somewhat because in the last 2 years, the school fees have been abolished in Zambia, so there's no need for school fees, payment of school fees anymore. There are still other needs for girls who come from vulnerable families that we are implementing. So Advance project has 10 DREAMS centers. So a DREAMS center is sort of the main focus where the activities take place. So it's usually placed in an area where there's a high HIV incidence, in a community where there's high HIV incidence, and not too far from a health center, so that for services that require referral to health centers, the beneficiaries can go to a health center. So this is a house in the community where a lot of activities take place, including economic strengthening activities, enrollment of DREAMS beneficiaries, and also a drop-in center where girls can come in at any time. There are books there where they can read. They can do a lot of activities. And then surrounding this community, these DREAM centers, we also have community posts, which are areas that are too far from the main DREAM center. In the community, especially in rural areas. And then we're implementing DREAMS in 4 districts within Zambia, 4 districts in 3 provinces. So the DREAM centers are in Mongu, which is the capital city of Western Province. And we have 2 centers in Southern Province, in Mazabuka, 4 centers in Southern Province, 2 in Mazabuka and 2 in Monze, and 4 centers in Chipata, which is the provincial capital for Eastern Province on the border with Malawi. So those are the sites where we're implementing. So Mongu in Western Province is an area which has high HIV incidence. From the Zambia data, we know that there's a lot of HIV in Western Province. And then Monza and Mazabuka, at the time that we were studying DREAMS in previous projects, these were some of the sub-national units within Southern Province where there was a lot of high HIV prevalence and lots of new HIV infections. And then Chipata in Eastern Province was previously a site for DREAMS implementation by a USAID project, but in 2023, this was handed over to a CDC implementing partner, so which is the advanced project. So that's how we took over the DREAMS program in Eastern Province. So the primary package comprises of social asset building, and it's offered to DREAMS beneficiaries. And we're using the Stepping Stones curriculum, which has 13 weekly sessions. So these sessions are conducted in safe spaces within the community, and each beneficiary is assigned to a mentor. So the sessions are conducted by mentors, and we target to have about 25 beneficiaries to each mentor, though the numbers can vary depending on the location of the safe spaces, the age of the beneficiaries, and a few other factors. But in general, about 25 DREAMS girls to one mentor. And so they carry out, they go on with this cohort for about 13 weeks. At the end of 13 weeks, they graduate. And this focuses on HIV prevention, violence prevention, and they're also being mentored. The mentors are slightly older than the DREAMS beneficiaries, but not too much older than them. So there's that interaction. They are free with them and they can freely interact. And the mentors undergo a training before administering this Stepping Stones curriculum. And then for the parenting program, we're implementing 2 programs at the moment. Is what's called the Families Matter program, which we're implementing in 3 districts. And then in Chipata, we're implementing Healthy Homes parenting program. So this seeks to improve communication between parents and the children that they take care of, with a goal that as far as violence is concerned, gender-based violence, if there was something that occurred, the girls would be free to discuss with their parents. If there are things that they notice that make them at risk, they'll be able to communicate with the parents. And this is something that's not very, very common in African settings, especially discussing issues of sexuality, sexual matters, HIV prevention. Those kinds of conversations are almost never had in families. And so So HYW would learn from their peers, from friends, or from other sources. And so these parenting programs are aimed at improving communication between caregivers and HYW. And then there's also comprehensive economic strengthening activities that are offered through the DREAMS program. There's a whole range of secondary packages which are listed in the slide that shows the achievement against the target, at least for the first year of advanced project. So these are some of the indicators that we follow for the DREAMS project. So for the primary package, it's mainly enrollment in the social asset building. So we have a target of 34,902, which is the denominator. And this is the number of active DREAMS beneficiaries that have started or completed any DREAMS service or intervention at the end of the reporting period. And then we also have the numerator, which is 33,645. And this is defined as the number of active DREAMS beneficiaries that have completed at least a DREAMS primary package of services or interventions at the end of the reporting period. And as of August 2024, we had achieved the target. So this was at 11 months, we had achieved the target for the primary package and also for a number of secondary packages. So the only ones where we're kind of lagging behind is educational support, and there are several factors that lead to that. And then there's also other programs that I didn't talk about. There's savings groups, community-based GV, gender-based violence prevention, and HIV and violence prevention in schools. We're also implementing mental health support for HYW because during the screening process, we discovered that there are some mental health issues that arise that, or at least that beneficiaries have. So actually this year we have a partner that's focused on that. We're also providing pre-exposure prophylaxis in DREAMS centers. So eligible adolescent girls and young women are offered PrEP in all DREAMS centers. And prior to 2024, the only PrEP that was available was oral PrEP, which is tenofovir and emtricitabine. But from February 2024, 2 of the DREAMS centers have been sites for long-acting injectable PrEP. So these are Mazabuka and Monze in Southern Province. So Zambia is one of the countries that's implementing long-acting injectable PrEP outside of the US and outside of clinical trial settings. So the information that we're generating from this is being analyzed so that it will be shared. We see how implementing of long-acting cabotegravir works in sub-Saharan Africa. So as of August 2024, we've had, for DREAMS programs that we're implementing, we've had 164 beneficiaries receive long-acting cabotegravir. And these are the ones who were newly initiated, and then some were switched from oral PrEP to long-acting cabotegravir. So what are the next steps for DREAMS programming? So a DREAMS program is quite intensive, and it is very resource intensive. So as PEPFAR contemplates the next steps in the overall HIV programming, there have been discussions or guidance on the next steps of DREAMS programming. And just overall, before I go to that, the overall incidence of HIV has decreased in sub-Saharan Africa between 2010 and 2023. In Zambia, for example, according to UNAIDS data, In 2010, there was 54,000 new HIV infections. And in 2023, there were 20,000 new HIV infections. Zambia, which was done in 2021, had 28,000 new HIV infections. So you can see the decrease almost by half of new HIV infections in sub-Saharan Africa. And most of these decrease in new infections have included decrease in AGYW, the target for the DREAMS program. So the DREAMS program will evolve in response to specific contexts, including this change in HIV incidence and also the planning for sustainability for the DREAMS program. So PEPFAR is calling the next phase of DREAMS as DREAMS Next Gen. And while the full DREAMS, the traditional DREAMS initiative requires implementation of the full package, which includes the core package and all the layering services, the secondary packages, DREAMS Next Gen will be more flexible and will be focused on sustainability. And it will be informed by HIV incidence at subnational level. So even within provinces, for example, regions within Zambia, there are differences in the incidence of HIV. There are some towns or areas that have higher new HIV infections than others, not so much. So the DREAMS Next Gen will be flexible to adapt to the context depending on the incidence of HIV. And also we'll work on partnering with host governments. In Zambia, this would include the Ministry of General Education, which would probably take up some of the roles like in the school-based programs, working with implementing partners, but also the Ministry of Education, schools taking a more active role. And then there's a Ministry of Community Services and Social Welfare, which could take up some of the roles, including the economic strengthening roles. And then there'll be Ministry of Health, of course, would need to take up some of the roles, again, working with partners. Already have DREAMS ambassadors who are Ministry of Health employee, and they work with implementing partners that are implementing DREAMS programs in different provinces. So each province has DREAMS ambassadors that work very closely. And the Ministry of Health, especially at provincial level, which is regional level, oversees DREAMS programs. So they do regular site supervision visits so they're fully aware of what's going on and can ensure that the programs being implemented align with the Ministry of Health priorities. So there'll be need to kind of continue that collaboration and where possible have Ministry of Health take up some of the roles and some of the roles continue with implementing partners. But because DREAMS is relatively new compared to other HIV programs like HIV testing and treatment, and other prevention services, that phase of having the Ministry of Health or other partners take over will probably be over a more prolonged period, compared to the other programs which the ministries of health have been conducting over a longer period of time. So there will still be need to continue working with partners for programs such as DREAMS. So again, this is from the UNAIDS 2024 update, which shows that even within countries, within regions, there's a difference in the incidence of HIV among AGYW. So the numbers there are per 1,000. So it would be less than 0.1% is considered low. 0.1 to 0.3% is moderate. 0.3% to 0.99% would be considered moderately high, and then 1% and above is considered high. And within Zambia, you can see that Western Province, which is where one of the dream centers we have, has some areas that are in the moderately high incidence. So those would probably need the full DREAMS package, whereas Eastern Province, close to the border with Malawi there, it might be in the moderate range. So some aspects of the DREAMS package may not be implemented in those regions. So what's been the impact of the DREAMS program? And again, this is from the 2024 UN AIDS global update. But there's also room for looking at this in more detail in countries, in Zambia, let me say, where DREAMS has been implemented. So I've been implementing DREAMS for over 6 years now. So just to kind of characterize what's been the main impact of DREAMS in those districts. So HIV incidence, as I mentioned, has decreased generally in sub-Saharan Africa. And in HYW, it's decreased by 51% between 2010 and 2023. And in some countries, actually, it's decreased by up to 70%. Zambia is not one of those. So there's been a big decrease in HYW. There's still a high incidence of HIV infections in HYW compared to adolescent boys and young men. So there's still need to have focused interventions, HIV prevention interventions for this population. Because if efforts were to stop at this point, we're going towards achieving epidemic control, there would be a rebound in incidence of HIV. And UNAIDS mentions that this is due to dedicated HIV prevention programs targeting HYW. And in subnational areas or regional areas that have high incidence of HIV, at least 61% of them in sub-Saharan Africa have dedicated HIV prevention programs for HYW. And this is mainly DREAMS and other programs funded by the Global Fund. But even within those areas, there are sites or locations that have moderately high incidence, so between 0.3 to 0.99% HIV incidence. And these contribute large absolute numbers to new infections for the country. So for those, there'll be need to continue more comprehensive, dedicated HIV prevention programs. Thank you. That's the end of my presentation. Opening it up for discussion now.
Thanks, Lottie. That was a nice presentation. Open up to the group. You can either unmute and raise your hand, or please feel free to use the chat, and we'll make sure we read your comments and questions.
Hi, Dr. Lottie. This is Cassidy. Great presentation and wonderful overview of the DREAMS program in Zambia. I just thought I thought you might want to add on a little bit about, or maybe you mentioned the STARS program. I didn't catch it, or maybe you could just highlight on the STARS program and how that project will help us understand more about what's going on with adolescent girls and kind of a way forward. Thanks so much.
Yeah, thank you. Yeah, I was actually considering adding that, but maybe we can have another question from Marie-Claude.
Hi, Lottie. Thank you. Very nice presentation. Would you like to provide more information about the next generation of DREAMS, what the PEPFAR envisioned, and then when do you see that transitioning to that new kind of the new phase of the DREAMS program? Thank you.
Okay. Lashley?
Yeah, a great presentation and quite an achievement to be able to estimate what it has done. My question is actually what Marie-Claude just asked, but I also wanted to find out what are your plans in terms of involving the boys or the men, as you said, because one of the comments you made was that that was an area you didn't really achieve great traction. So maybe you have ideas in terms of how to engage them, but this is really great work. Thanks.
Okay, thank you very much. Yeah, so I'm starting with Cassidy's question. So the STARS study is a study within the advanced project. And the goal of the STARS project is, as I mentioned, that one of the interventions for HYW is accessing family planning services and HIV prevention services, including PrEP. And there are a number of barriers to accessing these services. These include stigma. There's also attitudes of health workers that provide these services for these HYW. Sometimes they are frowned upon when they go to access these services. So this STARS program study is being implemented in a few African countries in this region, in Mozambique and in Zambia. And it's a collaborative community participatory study, which is mainly qualitative, which will seek to understand some of the barriers that HYW have in accessing prevention services, in accessing HIV prevention services, as well as family planning services. So this we've already studied it actually. So with training, this is being done in collaboration with University of Maryland, Baltimore, University of Maryland, College Park, because of it's largely qualitative research. So it will involve the HYW themselves being some of the investigators, and also the DREAMS ambassadors, the ones from Ministry of Health. And so that's about the STARS project. And then to answer the question from Marie-Claude on next-gen DREAMS. So this has several aspects. There's what they're calling enabling DREAMS. And so some of the aspects we've actually already started implementing them. So starting last year, we're allowed to implement some DREAMS-like activities in certain areas where we don't have, in districts where we don't have the full DREAMS package. So previously we could not implement DREAMS-like activities in some areas where we don't have the full DREAMS package. And I should probably mention that some of these ideas actually came, I think it was after a year or two of implementing circuits. I think when it was noted, and Cassidy can comment further on that, that the DREAMS program is quite expensive. And there were proposals to kind of implement what may be termed DREAMS-like activities in some areas in order to have a wider reach and to achieve the same things. So enabling DREAMS is one of the things that we've already started implementing, which is DREAMS-like activities in subnational units where we don't have a full DREAMS package. And then the others, collaboration, and those haven't started yet, with entities like Ministry of Community Development and Social Welfare and Ministry of Education. So the DREAMS program will actually be merged into one. Currently, it's being implemented by both USAID and CDC, and they want to combine it into one mechanism. And we've had meetings with USAID. They were just asking for ideas and suggestions on what the next DREAMS picture would look like, and we had some suggestions that we made to them. So I think the next-gen DREAMS will probably be more fully implemented when the mechanism is combined, and we hope to be some of the implementers for that. We're not sure whether they'll have one or two implementing partners, but we're hoping to be one of those that will implement the next gen dreams. And then the question on involving boys, yeah, that's a very good question, Ashley. And as I mentioned, that we haven't done a very good job at it. We focus mainly on AGYW, partly because of reduced resources. The funding that we have has not been adequate to spread it out to reach the AGY, to reach the young boys and young men as such. So I think we're still trying to see how we can expand on that. We're focusing on a program called Coaching Boys to Men, using soccer and other things that young boys are interested in to reach them with HIV prevention services, and more importantly, to try to change gender norms so that girls are protected, they're not at risk. I hope that answers those 3 questions. Cassidy, you could actually add some more on stars if you want to, just to elaborate some more.
Thanks, Doc. I think you captured everything. Yeah, just it's a qualitative study that we're doing in collaboration. The UMB is assisting with, along with support from University of Maryland College Park with our longtime collaborator, Kirsten Stobanow, and really assessing adolescent stigma and how reproductive stigma and how we can improve on that. And as Dr. Lottie said, it's youth-led with adolescent girls as investigators. So we're in the process of finishing data collection, and data analysis is also underway. And hopefully those findings help reveal kind of some important next steps for the DREAMS program. Thanks, over.
Thank you. So we're at the hour, and if there's not any other questions, we'll end. And if you think of anything, feel free to reach out to Lottie outside the call. Thanks, everyone.
Thank you.